Visual instructions. Use historically accurate images of African Americans relevant to the story. Millions of cancer patients around the world have been treated with chemotherapy, but few people know that a black woman doctor helped make that treatment possible. Her name was Dr. Jane Cooke Wright, and her work helped turn chemotherapy from a dangerous experiment into a life-saving treatment used around the world. Jane Cooke Wright was born November 20, 1919, in New York City. Medicine was part of her life from the beginning. Her father, Dr. Louis T. Wright, was one of the first black physicians on staff at Harlem Hospital and a pioneer in cancer research. Inspired by her father's work, Jane Wright decided she would become a doctor too. She attended Smith College, graduating in 1942, and then went on to earn her medical degree from New York Medical College in 1945, at a time when very few women, especially black women, were doctors. After medical school, Dr. Wright joined her father at the Harlem Hospital Cancer Research Center, where they studied how new drugs could be used to fight cancer. At the time, chemotherapy was still experimental and extremely risky. Many doctors believed it would never work. But Dr. Wright believed cancer could be treated scientifically. She began testing cancer drugs on human cancer cells grown in the laboratory. This allowed doctors to see which medicines worked before giving them to patients. This approach made chemotherapy safer and more effective. Her research helped doctors learn how to adjust chemotherapy doses, combine different drugs, and treat cancers that had once been considered untreatable. Because of her work, chemotherapy became a real medical treatment instead of just an experiment. Dr. Wright spent years studying how cancer begins at the cellular level, how abnormal cells grow and spread through the body. Her research helped scientists better understand how a fertilized cell develops and changes, knowledge that became important not only for cancer treatment but for modern medical science. In 1967, Dr. Wright became Associate Dean and Professor of Surgery at New York Medical College, making her one of the highest-ranking black women in academic medicine at the time. She also became the first black woman elected president of the New York Cancer Society. Dr. Wright traveled around the world teaching doctors new ways to treat cancer, helping bring modern cancer treatment to patients far beyond the United States. Dr. Jane Cooke Wright lived until 2013, reaching the age of 93, and leaving behind a legacy that has saved countless lives. Today, millions of people receive chemotherapy treatments every year, and many of them owe their survival to the work of a doctor whose name is rarely mentioned in history books. Dr. Jane Cooke Wright helped change the way the world fights cancer. For more stories like this, subscribe to Chronicles in Black News Stories every Monday, Wednesday, and Friday.